Hello, friends. Welcome to our YouTube channel, SLP Sanjay Kumar, Voice Therapist. And we are live. And with me, Bimal Dahal is here. And Bimal Dahal is having some voice problem. And today we are before treatment live. So don't forget to watch his post treatment live. And please subscribe our YouTube channel so that you can see his post therapy live also. So, Bimal Dahal, I want speech sample before treatment, and we are live. So, say about yourself and your problem.
Hello, sir. My name is Bimal Dahal, and I am from Australia, Brisbane, and I am having Puberphonia from very long time. I try to.
You can just tell the exactly your problem. Technical term will be creating confusion. Just what challenges you are facing that you can tell.
This problem has been very terrible situation for me. I cannot speak in front of people. It feels embarrassing when people say your voice is like female, or especially they say like my voice is like old female, not a female, and that really tones me down sometimes. And I keep inside my house. I don't want to go out much. And I found a YouTube video of Sanjay sir, and I contacted him, and now I'm here with him.
Yes, so we will be treating this problem by online voice therapy only. And why? Since how long you are facing this problem, Bimal?
Exactly, I'm not sure, sir, but I think when I was in age 14, 15, I'm facing this problem. I didn't know that time I have a puberphonia, but a couple of my friends says in phone, and then your voice is like older lady, and I realized my voice got changed.
Okay. So on phone, sometime in rare case, people say yes, ma'am, or madam, something like that.
Yes, a couple of times.
Yeah. So you use one technical term, puberphonia. So why I ask you not to use a technical term? Feminine voice can be reflected due to so many reasons. The pitch, high pitch voice, or feminine voice can be due to so many reasons. Even nature has not given sufficiently the mass of the vocal cord and the length of the vocal cord. We call technically sulcus vocalis. So in that case also voice will be feminine and high pitch. If there is a hormonal issue like testosterone hormone, then also it has been seen that there will be some pitch will be higher. It has also been seen that some patient will try to correct the voice problem by himself, and they will develop the muscle tension dysphonia. In that case also we have seen the high pitch voice, and sometime people do some wrong vocal exercise, or they will try to take help from the healthcare quacks, those who are not professional speech therapists. Sometime due to the wrong vocal exercise they will develop the phonatory gap. So that's why I ask you don't use the technical term. So high pitch or feminine voice can be happen due to so many reasons also. And of course in the puberphonia or those patients, those who are not having the history of vocal abuse and all. So I have seen that during the puberty, the mass of the vocal cord, length of the vocal cord changes. I'm just talking about the typical patient, those who have not experimented and they don't have the hormonal issue, they don't have phonatory gap, they don't have the muscle tension dysphonia, they don't have the phonatory gap, sulcus vocalis. So those vocal cords are normal. I'm talking about that situation. What happened during puberty? Mass of the vocal cord, length of the vocal cord increases due to a hormone called testosterone. So the pitch reduces. Before puberty, there will be no much difference between a male and the female voice. Like boys and girl voice will be almost same. But during puberty, because of the effect of testosterone hormone, the mass of the vocal cord increases, length of the vocal cord increases, and the pitch reduces. You can just very easily correlate with the guitar string also. In the guitar string, you have seen that thin string produces high pitch voice, and thick string produces low pitch voice. So before puberty, vocal cord is thin, so voice should be high pitch voice. And during puberty, because of the effect of the testosterone, or after puberty, the voice becomes low pitch voice because the vocal cords become thick. Okay,
Yes.
and now your age is 27. So of course the puberty has gone, and after puberty you are here. So your pitch should be lower. So why the pitch is higher? Because from childhood to puberty you spoke in a high pitched voice, and during puberty mass of the vocal cord, length of the vocal cord changes. So now the pitch should be lower because of so many years habit. You have not accepted the change which has happened during the puberty. So if this is the vocal cord, so instead of vibrating the whole mass of the vocal cord, whole length of the vocal cord, you may be vibrating thin edges of the vocal cord, or maybe not vibrating the vocal cord in an effective manner. So that's why the pitch is slightly high, and the vocal cord amplitude of vibration is not sufficient, so the loudness is also less. So if any string vibrates, so if amplitude of vibration will be sufficient, then only the loudness will be more. And if amplitude of vibration is not sufficient, then the loudness will be less. So there are two issues. One is the pitch and other is the loudness in your case. And with the voice therapy, we try to work to increase the amplitude of vibration of your vocal cord, as well as we'll try to stimulate the whole mass and the whole length of the vocal cord, so that the pitch will reduce and the loudness will improve. And person to person, the voice therapy result vary also. Like health science is not exactly like a mathematics. 2 plus 2 is equal to 4. I say many time in the live. So therapy result depends on how good the therapist is, how much skill he has in the particular disorder, and second thing is how the your body is responding on the therapy. That also matter, and how much faith and dedication the patient is having. That is also important. You must have heard in the placebo in that medical field. The placebo is nothing. That is just sugar pill or something fake medicine. It's nothing inside, but it will be given to the patient. It will be said that this is the best medicine. It's going to help, and the patient condition improve due to the placebo also. So this is, opposite is also true. If the therapist is good, body is also capable to respond on the therapy, but patient don't have the faith on the therapist and the techniques, then also therapy is not going to help. So I suggest those patients who have the motivation, who have the faith, they should only start the voice therapy, and they are a good candidate for the voice therapy. If they don't have the faith, I suggest don't start the voice therapy, at least at my center, because it's not going to help. And to have a confidence and the hope, keep watching my YouTube channel, those who are having the communication disorder. So this will give faith and motivation. And after that, once we'll start working in a right direction, of course, we expect good result. And yes, Bimal, there are some people have joined. So you can tell about your problem so that they can understand and they can listen your voice.
As I say, high pitch voice problem. This is I don't know what to say.
Yeah, just tell about your problem. Maybe you have already told, but still you can tell, because in the live sometime what will happen, sometime in the beginning some new people will be there, in the middle some other people will be there, in the end some other people. So nothing is wrong in the repeating about, because our aim is to let the people listen your voice and your problem, so that they can watch after therapy live also, and they can get an idea how the speech language pathologist can help to the people who are having the communication disorder.
Yes. I'm feeling difficulties in speaking. Like sometimes I try to speak even hard. I have to give pressure to speak. And even though I try very hard, my voice is not really good. And then when I see the people speaking on the mic, and then I feel like, why not me? So it really is a depressed kind of thing. And so I'm here with Sanjay sir. Let's hope for the best.
Yes. And because of the corona pandemic, we are giving mainly the online voice therapy. So we'll be correcting, or we'll be trying to correct your problem this by online voice therapy only. And yes, I can see some of the people, those who are watching. Thank you, Dr. P.K. Sani, for watching us, and thank you, Naman. And yeah, Naman is asking, sir, my voice is also like female. Yes, Naman, before any suggestion, I will try to listen your voice, and maybe if needed, I may suggest some test. So please call us at 080-420-41980. We will try to do the perceptual evaluation if you are from India. If you are from outside India, you can call us at 9180-420-41980, and we will do perceptual evaluation, and then accordingly we will suggest. And thank you, Deepak, for joining and watching us. Yes, Deepak, after the perceptual evaluation, we suggest the online therapy will be helping you or offline therapy will be helping to you. So of course, for few communication disorder, we have seen that online therapy helps, but not all the communication disorders. So after the perceptual evaluation, we will be able to guide. And sometime we ask you to send the laryngoscopy report, but not for all the communication disorder. So Naman, you can call us, and you can also go to our website www.speechtherapyindia.in, and you can click reach me. So there you will also find contact details, and you can mail us, and we'll help you, and we'll guide you what has to be done. Yes, first we'll do the perceptual evaluation. Sometime what will happen, the patient will say, sir, hoarse voice है, breathy voice है, कितना time लगेगा ठीक होने में? और जब hoarse voice की बात करते हैं, when we talk about the hoarse voice, the reason can be so many things. It can be the vocal cord paralysis, there can be vocal nodule, there can be vocal polyp, there can be cyst, there can be cancer. तो मैं कैसे बता दूं कि हॉर्स वॉइस है तो कितना टाइम लगेगा और आप ठीक होंगे कि नहीं होंगे? और कई बार ऐसा होता है कि देयर विल बी सम टाइम पेशेंट विल बी सेइंग, सर आई हैव a stammering problem, and when we do the assessment, we find the misarticulation problem. So we suggest first you can call us, and then we will be able to guide you. And I suggest patient not to diagnose the problem. Some patient is asking, Deepak, is it for puberphonia, what? So we don't know what problem exactly you are having. So first we will try to listen your voice, and then we'll be able to guide you better, Deepak. So contact number is 080-420-41980. So we are giving online therapy for the few communication disorder, like vocal cord paralysis, stammering, and even the pitch and loudness issue, but not all the cases. There are some cases we are giving online therapy that will be able to guide you after the perceptual evaluation. So Deepak, I think you got some idea. So my suggestion is, Deepak, to first you can call us at 080-420-41980. And please avoid technical jargon. Instead of technical jargon, you just try to tell your problem, what challenges you are facing. Because sometimes patient will see and they will all diagnose themselves. So it creates confusion to the many people. So based on the perceptual evaluation, we'll be able to guide you. And yes, yeah, and our contact number is 080-420-41980. And apart from pitch and loudness correction at our center, we also provide voice therapy for the people having dysphonia due to the vocal cord paralysis, hoarse and breathy voice. We also provide speech therapy for the people having stammering, stuttering, हिंदी में बोलते हैं हकलाने की जो समस्या होती है. And we also provide voice therapy for the people whose voice has suddenly gone, complete absence of voice. We call it the functional aphonia. So you can explore functional aphonia at our YouTube channel playlist to get an idea. And of course, for the pitch and loudness issue, we provide the voice therapy. So thank you everyone for joining us and watching us. Thank you, Dr. P.K. Saini. Thank you, Naman. Thank you, Deepak. And yes, Bimal ji, फिर से आप थोड़ा बताइए अपनी प्रॉब्लम को. What problem you are facing?
I'll speak in Hindi.
हाँ, बोलिए हिंदी में ही.
मेरा नाम बिमल दाल है. अभी हम ऑस्ट्रेलिया में रह रहे हैं. बोलने में तकलीफ होती है मुझे समटाइम्स. दोस्त लोग कहते हैं कि तेरा आवाज़ थोड़ा पतली है, ऐसा है वैसा है, वॉइस फेमिनिन जैसा आता है. सो मैंने उतना ध्यान नहीं दिया था पहले. बाद में फिर मेरे को रियलाइज़ हुआ तो सच में है. तो मैंने इसका रिसर्च करना चालू किया. तो संजय सर का वीडियो देखा यूट्यूब पे, उधर से कांटेक्ट किया और आज संजय सर के साथ.
हाँ, रोहित सिंह पूछ रहे हैं कि सर माई वॉइस इज़ वेरी डीप, इज इट एनी डिसऑर्डर? तो जैसे हमारी हाइट अलग होती है, हमारा कलर अलग होता है, उसी तरह से हमारी वॉइस की क्वालिटी भी थोड़ी डिफरेंट होती है। जब तक कि लिसनर को एबनॉर्मल ना लगे तब तक हम ये कहेंगे कि ठीक है, वॉइस प्रॉब्लम नहीं है। लेकिन जब बहुत ही ऑड लगने लगता है, सुनने वालों को समझ में नहीं आता है, अब जैसे आपने बताया कि आपकी लाउडनेस सफिशिएंट नहीं है, लोग सुन नहीं पाते हैं, कभी कभी लोग मैडम बोल देते हैं, तो लेकिन जब सब लोग आपकी वॉइस को लाइक करते हैं और लोग समझ पाते हैं, आप अपनी बात को अच्छे से रख पाते हैं, तो मुझे नहीं लगता कोई कम्युनिकेशन प्रॉब्लम है। जैसे हमारी हाइट अलग होती है, तो उसी तरह से जो है हमारी वॉइस की क्वालिटी भी डिपेंड करती है वोकल कॉर्ड के मास और लेंथ पे। तो नेचर ने हमारा वोकल कॉर्ड कैसा दिया है उस पर भी वॉइस डिसाइड होता है। और उसके बाद रेजोनेटिंग कैविटी, जैसे वोकल कॉर्ड से स्टार्ट होकर मुंह तक जो हमारा माउथ का ओपनिंग है, इसके बीच में जो एक कैविटी है वो एक रेजोनेटर की तरह काम करता है। जैसे कि आपने गिटार को देखा हो तो गिटार में दो पार्ट हुआ, एक तो स्ट्रिंग वाला पार्ट हुआ और दूसरा जो बॉक्स हुआ। तो बॉक्स क्या काम क्या है, जो है वो एक रेजोनेटिंग कैविटी की तरह काम कर रहा है। तो हमारा जो वोकल कॉर्ड्स है वो भी एक स्ट्रिंग की तरह के स्ट्रक्चर है, उसको समझ लीजिए। और वोकल कॉर्ड से स्टार्ट हो करके जो माउथ को ओपनिंग तक है वो क्या है, एक रेजोनेटिंग कैविटी हुआ। ठीक है, तो जो वॉइस की क्वालिटी डिपेंड करेगी किस पे, वोकल कॉर्ड्स पे भी डिपेंड करेगी और रेजोनेटिंग कैविटी पे डिपेंड करेगी। तो जब हमारी हाइट डिफरेंट हो सकती है अलग अलग लोगों की, तो नेचर ने अगर रेजोनेटिंग कैविटी एक पर्टिकुलर काइंड दिया हुआ है और वोकल कॉर्ड की भी एक थिकनेस अगर थोड़ी ज़्यादा है, तो वॉइस लो पिच हो सकती है। तो कह सकते हैं सुपर मेल की तरह वॉइस है। बहुत सारे हमारे मूवी एक्टर्स भी हैं, फेमस हैं, जिनकी वॉइस काफ़ी लो पिच है। तो जब तक कोई लिसनर ये ना कहे कि मुझे एबनॉर्मल लग रहा है, समझ नहीं पा रहा है, तो हम क्यों कहेंगे कि डिसऑर्डर है। उसके लिए हम कुछ सजेस्ट नहीं करते हैं। लेकिन फिर भी रोहित सिंह जी, आपके लिए सजेशन ये है कि यू कैन कॉल अस एट 080-420-41980। विल डू द परसेप्चुअल इवोल्यूशन एंड अकॉर्डिंगली विल गाइड यू if you have any communication problem or not. But based on the comment which you have deleted, just I think, or detractor, I don't know, uh, I'm not able to understand, are you having a really communication problem or not, Rohit Singh? This was for the Rohit Singh. एंड और भी अगर कम्युनिकेशन प्रॉब्लम के बारे में जानकारी चाहिए और ट्रीटमेंट से पहले, ट्रीटमेंट के बाद क्या चेंजेस हो सकती है वॉइस और स्पीच में, तो हमारे यूट्यूब चैनल के प्लेलिस्ट को ज़रूर एक्सप्लोर कीजिए। उस प्लेलिस्ट में डिफरेंट कम्युनिकेशन डिसऑर्डर मिलेंगे, उनका प्री और पोस्ट वॉइस थेरेपी, स्पीच थेरेपी आपको सैम्पल मिलेगा। उससे आप एक समझ सकते हैं कि हमारे सेंटर में किस तरह का काम होता है, व्हाट काइंड ऑफ ट्रीटमेंट वी आर गिविंग फॉर व्हाट आर द कम्युनिकेशन डिसऑर्डर यू कैन एक्सपेक्ट from us, about the treatment, what kind of treatment you can expect from us for the different communication disorder. So you can must explore our playlist and also subscribe our YouTube channel and press the bell icon so that when we'll be uploading post therapy live you can get notification. तो मुझे लगता है कि कुछ नए क्वेश्चंस नहीं आ रहे हैं। विमल जी, हम लोग इस लाइव को स्टॉप करें।
Okay, sir.
Yes, I think any question you have, I can see that people are watching. You can ask. Otherwise, we'll stop this live. I'll just wait for 2 minutes. And so, Bimal ji, tell by the time what exactly problem you are facing, so that people can listen your voice again.
As I just say, I'm facing low voice problem.
Means loudness issue. Volume is less when you are speaking.
So volume is less, as you say, and sometimes even when I drink too cold drinks, like when I sometimes go out with friends and have some beer, and I'm unable to speak, and then my voice suddenly changes, like I don't know what, and then.
Okay, thank you, Bimal. We'll do the needful. And just for awareness, I'll speak a few things for the public awareness. Please, yeah, those who are watching live, for them it is. Nowadays, because of the social media, everyone is having the platform to speak and put their words. So this is good, very good thing also. But at the same time, there are some healthcare quacks. They will write in their YouTube channel, on the social media and the other website. They are also speech therapists, but they will not be having the qualification in the speech therapy. And sometimes innocent people will think they are going to take treatment from those kind of people, and they are speech therapists. So in such cases, sometimes vocal cord may damage due to some wrong exercise and wrong vocal exercise. So whenever you are trying to take the speech therapy, try to find out if this particular center like ABCD, whatever the center is, who is going to give therapy, and in that center, what is the name of the therapist, from where the therapist, speech therapist or speech language pathologist has studied, from which year he got the graduation or post-graduation degree in the speech language pathology and audiology field. And if you have a doubt, you try to find out if he is registered in the Rehabilitation Council of India or not, and if he is registered, what is the RCI number, especially for the India I am talking. So if there will be healthcare quacks, they will not able to give the proper answer, where, which college they studied, what qualification they have, and what is their RCI registration number and all these things. So you can filter, this is the healthcare quacks, on this is the speech therapist. So this is the way, this is very, very important, because everybody is, those who are unemployed, they will read something and they will try to make some YouTube channel video and they will put some information, and innocent people will ask question, सर मुझको ये प्रॉब्लम है, क्या ट्रीटमेंट करें, तो बोलेगा ये एक्सरसाइज ABCD करो, और फिर उसके बाद नहीं ठीक हो रहा और थोड़ा दिन कर लो. तो ये सब भी होता है. और कुछ लोग तो कंसल्टेशन फी लेकर ट्रीटमेंट भी स्टार्ट कर देते हैं. अगर कभी गलती से ऐसे क्वैक्स को जाने को मिला स्पीच थेरेपिस्ट की क्लिनिक, तो देखा वो क्या करा रहे हैं, तो एक दो चीज़ें कुछ देख लिया, कुछ पढ़ लिया, फिर शुरू कर दिया. तो ऐसे लोग जो हैं आपके वॉइस वोकल कॉर्ड हेल्थ के लिए जो है खतरनाक हैं. तुक्के से कभी ठीक हो भी जाता है, झोला छाप से भी, लेकिन ज़्यादातर ख़राब होता है. So your vocal cord and voice is very important, so give respect to us and try to take always the help from the professional, those who are having the certification, qualification, RCI registration, from them only. And my name is Sanjay Kumar. I will just introduce myself also. By profession, I am a speech language pathologist and audiologist. I have studied from All India Institute of Medical Science, New Delhi. I got my Bachelor of Honors in Speech and Hearing Science degree from AIIMS, New Delhi, All India Institute of Medical Science, New Delhi. And I have done my post-graduation in the field of speech language pathology from the University of Mysore. So this is my introduction. And of course, my area of interest is treating voice disorder. Thank you everyone for joining us. Thank you. I think I can see some question. हाँ जी नमन जी, ठीक है, आप फ़ोन कीजिए हमें 080 पर नमन 08042041980. We'll do the perceptual evolution and accordingly we'll guide you. Yes, Naman, I got some idea about your problem. I will try to talk on the phone also and try to understand your problem in detail after the perceptual evolution. So feel free to call us at 08042041980. Now only you can call and we will try to help you after the perceptual evaluation in the form of guidance, and if needed we'll suggest for voice therapy online or offline based on our evaluation. So thank you everyone for joining us at our website www.speechtherapyindia.in. Click reach me and you'll get our contact details. And thank you everyone. And thank you others for joining us. Thank you everyone. Thank you everyone. And I think I'm getting some questions. Umesh Vandari, yes, you can call us at 08042041980. I will repeat again, 08042041980, and we'll do the perceptual evaluation and accordingly we'll guide you. And if you're from outside India, you can call us at 918042041980. We'll do the perceptual evaluation and we will guide you. Yes, in the stammering case also, Umesh, speech therapy helps. And I have seen in the stammering case, 80% treatment efficacy. Suppose 100 people are coming to my clinic for stammering speech therapy. I have seen significant change among 80% of population after the speech therapy. Means we have seen out of 180 people have some good changes after speech therapy. So I'm expecting, it is more than 20, so I'm expecting you will also improve. And why the stammering happens? For that, I'll be just speaking, maybe just for the awareness. When we speak, there are hundreds of our body muscles works in a very, very coordinated way. If coordination among these muscles goes, fluency goes. So in the speech therapy, there will be, we'll try to coordinate all those muscles which are involved in the speech production. Yes, others, you can call us at 08042041980 for more information if you have such kind of any questions. And yeah, so I'll be just trying to explain about the stammering. I think due to the masses and what I want to say in the stammering, it's a little bit coordination is affecting. So I'll be just for 3-4 minutes, I'll be not be giving answer to any question. So let me explain about the stammering. Okay. For the stammering, I'll be telling why the stammering happens. Of course, Bimal Dahal, your problem is not stammering, but I have a question, so I'm just trying to give the answer. To understand the stammering, let's first understand how the normal speech production occur. For the normal speech production, first thing is the thoughts that comes in the brain. Then we take air, that air goes to the lungs. When we breathe out, we put air pressure below the vocal cord. So once you put air pressure below the vocal cords start moving like a string of a violin and guitar, and sounds will generate. Then we modify that sound into different sound with the help of our lips, tongue, jaw, teeth, palate. These are known as articulators, like lips, teeth, tongue, palate. These are known as articulators. And so when we speak one sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cord moves, sound generate, we modify that sound into different sound with the help of our articulators. In one sentence, there are so many words. In each word, there are so many sound. Each sound has its own place, own manner of articulation. And so it's quite complex process. In this process, there are hundreds of our body muscles works in a very, very coordinated way. If coordination among these muscles goes, fluency goes. So I can say this statement is universal. When there is a stammering, there is something lagging the coordination among the speech production muscles with the brain. And in the speech therapy, what we do, we try to coordinate all these muscles. Those are involved in the speech production. For example, for sound generation, we need air pressure. So from where the air will be coming? By breathing. So first technique we teach in the stammering treatment will be the some breathing technique. Then is the what? The movement of the vocal cords. So the next thing I'll be teaching coordinating the breathing muscle as well as the laryngeal muscles. So some vocal exercise we give, saying different vowels. Then we come to the words, then phrases, then sentences, and finally conversation. So conversation with the therapist, then to the outside world. So this is the roughly plan of treatment for the stammering. But it's just like I'm sitting inside a room and explaining how to do the swimming. So it's better to take the help of a speech therapist, those who are certified, and they will guide you better. And even we are also a speech therapist, speech language pathologist, so we can take help from us, those who are having the stammering. And sometimes people ask, what is the cause of stammering? So we have seen there are certain genes also which are responsible for the stammering. I have seen some patient whose grandfather was having a stammering, son was having a stammering, even grandson is having the stammering. And if there are twins brother, the twins were having the stammering. So we can say that the stammering can be happen due to some genes also. But at the same time, I have seen that the patient, there was a one child who was absolutely normal during the childhood, but his friend was having a stammering and he was trying to tease his friend, and the normal child developed the stammering. So we can say it's a learned behavior, because some normal person also, if you're doing the mimicry of a stammering guy, he developed the stammering. I have seen that the child was absolutely normal. He had a head injury and after that he developed the stammering. So we can say that stammering can be due to some neurological issue. It can be neurogenic in origin. I have seen that one patient, a child was absolutely normal and he was very much emotionally attached with the grandmother. When grandmother died, the child developed the stammering. So we can say that it may be the emotional or psychological reason. So you can say that so much variation is there, starting from the genetic to just learned behavior to the neurogenic. So proper assessment is very, very important from the professional, and accordingly they will also provide the speech therapy. But one thing is very universal, something lagging the coordination among the speech production muscles with the brain during the stammering. So therapists will try to coordinate all those muscles which are involved in the speech production, and we have seen good result, like almost 80% treatment efficacy in case of stammering. But some healthcare quacks, some jhola chap will tell you 100% will cure you, and they will tell you, they will not be telling their speech therapist. They will tell, I had a stammering, I treated myself, I am curing others. So this will be. And sometimes they will tell, I was seeing in some online some comment, what a doctor can do, what a speech therapist can do if he has not developed the stammering. So if a doctor is treating the cancer patient, so doctor should first suffer with the cancer, then only they should start the treatment. So I don't know how the stammering patient they treat. Actually, this stammering patient will go sometime to the speech therapist, so they will get some idea, they will study something, and they will combine those things, and they will say that, okay, I had a stammering, I cured myself, I'm curing others, and they will take guarantee also because of the unemployment. But if you want to really help, you should take the professional who have studied the speech pathology field. Then you will get better help, not from the healthcare quacks and jhola chap. So now I'll be seeing the questions. I was getting distracted, so I turned the question in different way. Okay. Yeah, so now I'm seeing the question. So thank you again, everybody, for joining. Dr. P.K. Saini, Naman, Deepak, and Umesh. I think I have explained a lot about the stammering. And yes, Dhruv, thank you. And yes, तो ठीक है. और thank you so much, everybody, for joining us, and subscribe our YouTube channel. And yeah, now again I'm getting questions. Already I have spoken about the Puberphonia so many times, so please watch my old live also. And in this live also, in the beginning, I've already spoken, Naman, about the Puberphonia and the some high pitch voice, feminine voice. So you can call us at 080-420-41980. After perceptual evolution, we'll be able to guide you. Thank you, everyone, for joining us. And thank you, Bimal Dahal, for being live. Thank you. Thank you so much.
So much.
Thank you, everyone. Thank you.
Things.
Yes, for any information, feel free to call us at 080-420-41980. And you can click our website www.speechtherapyindia.in, and there will be reach me. So you can call us, you can mail us, and we will try to communicate effectively. Thank you, everybody, so much. I think I was expected only